Hi, my name is Elena, and today we will be learning about the effects of anesthesia. Anesthesia depresses the function of the central nervous system, CNS, significantly, resulting in unconsciousness. This depression is reversible, unless an overdose is given. Induction of unconsciousness. Veterinary anesthetics act on various regions of the brain to induce a state of unconsciousness. They suppress consciousness, rendering the patient unaware of their surroundings and any painful stimuli. This allows for pain-free and stress-free surgical procedures. Depression of brain activity. Anesthetics typically depress brain activity, leading to a reversible reduction in the patient's level of awareness and responsiveness. They do so by affecting neurotransmitters and receptors in the brain, leading to decreased neuronal firing. Amnesia. Many anesthetic agents induce amnesia, meaning the patient will not remember the events that occurred during the period of anesthesia. This amnesic effect is essential in preventing traumatic memories of surgery. Muscle relaxation. Some anesthetics, particularly neuromuscular blocking agents used in combination with general anesthesia, induce muscle relaxation. This is important for facilitating surgical procedures and preventing involuntary muscle movements. Anticonvulsant effects. Certain anesthetics have anticonvulsant properties and can help prevent or control seizures, which may be relevant in some veterinary patients. Vasodilation. Anesthetics can affect blood vessels in the brain, causing vasodilation, widening of blood vessels. This may influence cerebral blood flow and intracranial pressure, which needs to be carefully monitored and managed during anesthesia to prevent complications. Reduction in metabolic demand. Anesthetics reduce the brain's metabolic demand for oxygen and glucose. This is important in situations where blood flow or oxygen delivery to the brain may be compromised during surgery. Controlled awakening. The reversible nature of anesthesia means that the effects on the brain are carefully controlled. Once the surgical procedure is complete, the anesthetics are discontinued or reversed to allow the patient to regain consciousness safely. It's important to note that the specific effects of veterinary anesthetics on the brain can vary depending on the type of anesthetic agent used, the patient's species, age, and overall health, and the anesthesia protocol employed. Anesthesia can depress the cardiovascular system both centrally and peripherally, so it is common to see a reduction in cardiovascular output. Vasodilation or vasoconstriction of the peripheral blood vessels is also common, depending on the anesthetic agents utilized. The specific effects can vary depending on the type of anesthetic agent used and the patient's individual physiology. Here are some common effects of veterinary anesthetics on the cardiovascular system. Depression of myocardial function. Many anesthetic agents, especially inhalation anesthetics like isoflurane and sevoflurane, can depress myocardial, heart muscle, function. This can lead to a decrease in cardiac output, which is the volume of blood the heart pumps per minute. The degree of depression depends on the depth of anesthesia. Reduction in heart rate. Some anesthetics, such as opioids and certain induction agents, can cause a reduction in heart rate, bradycardia. This effect is often countered with medications or adjustments to the anesthetic regimen to maintain appropriate heart rate levels. Vasodilation. Anesthetics often cause vasodilation, which is the relaxation and widening of blood vessels. This can lead to a decrease in systemic vascular resistance, SVR, making it easier for the heart to pump blood throughout the body. However, excessive vasodilation can result in hypertension, low blood pressure. Blood pressure changes. Anesthetics can have variable effects on blood pressure. Inhalation anesthetics tend to cause dose-dependent hypertension, especially when used at higher concentrations. Intravenous anesthetics and other agents may also influence blood pressure. Arrhythmias. Some anesthetics, particularly certain induction agents and inhalation agents, can lead to arrhythmias, abnormal heart rhythms. These can include bradycardias, tachycardias, and other irregular rhythms. Monitoring the patient's ECG, electrocardiogram, is essential to detect and manage arrhythmias during anesthesia. Myocardial oxygen demand. Anesthetics can reduce myocardial oxygen demand by decreasing heart rate and contractility. This can be advantageous in situations where oxygen supply to the heart may be compromised. Controlled hemorrhage. Anesthetics can be used to reduce blood loss during surgery by inducing controlled hypertension. This is a technique employed in specific surgeries to minimize bleeding, maintenance of blood pressure. In some cases, medications, such as vasopressors or inotropes, may be used to maintain blood pressure and cardiac output during anesthesia. These drugs can counteract the hypertensive effects of certain anesthetics. The effects of veterinary anesthetics on the cardiovascular system must be carefully monitored and managed during anesthesia. Anesthesia protocols should be tailored to each patient's needs, and the close monitoring of vital signs, including heart rate, blood pressure, ECG, and oxygen saturation, is important to ensure the patient's cardiovascular stability. The goal is to balance the anesthetic depth required for the procedure with the maintenance of cardiovascular stability to ensure the patient's safety and well-being during surgery. Inhalant anesthetic agents have the ability to reduce blood flow to and through the liver because of the reduced cardiac output. Here are some of the common effects of veterinary anesthetics on the hepatic system. Hepatic blood flow. Anesthetics can influence hepatic blood flow. Inhalation anesthetics, such as isoflurane and sevoflurane, can lead to a reduction in hepatic blood flow, which may affect the liver's ability to process drugs and other substances. This effect is typically reversible upon awakening from anesthesia. Drug metabolism. The liver plays a significant role in metabolizing drugs and anesthetic agents. Certain anesthetics, especially those metabolized by the liver, may affect hepatic enzyme activity. The extent of this effect varies depending on the specific anesthetic and the patient's liver function. Biotransformation. Some anesthetic agents, such as inhalation anesthetics, are biotransformed in the liver. This process can lead to the production of metabolites that may have varying effects on hepatic function. The liver must metabolize and eliminate these compounds from the body. Enzyme induction and inhibition. Anesthetics can induce or inhibit hepatic enzymes that are responsible for drug metabolism. This can influence how other medications, including analgesics and antibiotics, are processed in the liver. It's important for potential drug interactions to be considered when using anesthetics in combination with other drugs. Hepatic clearance. Hepatic clearance refers to the liver's ability to remove drugs and waste products from the bloodstream. Anesthetics may impact hepatic clearance, potentially affecting the duration and intensity of their own effects and those of other medications. Hepatic perfusion. Adequate hepatic perfusion is essential for the liver's function. Maintaining appropriate blood pressure and hemodynamic stability during anesthesia is crucial to ensure that the liver receives an adequate blood supply. Recovery period. Some anesthetics can have prolonged effects on hepatic function during the recovery period. It's important to monitor patients postoperatively to assess their liver function as they metabolize and eliminate anesthetic agents from their systems. Patient-specific factors. The effects of anesthetics on the hepatic system can vary among individual patients, particularly in cases of pre-existing liver disease or conditions that may compromise hepatic function. Inhalant anesthetic agents have the ability to reduce blood flow to the kidneys because of the reduced cardiac output. Additionally, general anesthetic can impact on urine output, electrolyte excretion, and glomerular filtration. Here are some of the common effects of veterinary anesthetics on the renal system. Renal blood flow. Anesthetics can influence renal blood flow. Inhalation anesthetics, such as isoflurane and sevoflurane, typically cause a reduction in renal blood flow, which can affect the kidney's ability to filter blood and regulate fluid and electrolyte balance. This effect is often reversible upon awakening from anesthesia. Glomerular filtration rate, GFR. Anesthetics can alter the glomerular filtration rate, which is the rate at which the kidneys filter waste products and excess substances from the bloodstream. Some anesthetics may decrease GFR, potentially leading to a decrease in urine production and alterations in waste product clearance. Osmolality and electrolyte balance. Anesthetics can disrupt the normal osmolality and electrolyte balance in the renal tubules. This can affect the reabsorption and excretion of water and electrolytes in the kidneys, potentially leading to changes in urine concentration and electrolyte levels, diuresis. Some anesthetics may cause increased diuresis, the urine production, during anesthesia. This can lead to the loss of fluids and electrolytes, which need to be monitored and managed during surgery, oliguria and anuria, in some cases, particularly when a patient experiences prolonged or severe hypertension, low blood pressure, during anesthesia. Renal blood flow can be compromised to the extent that it leads to oliguria, reduced urine output, or anuria, absence of urine production. Patient-specific factors. The effects of anesthetics on the renal system can vary among individual patients, particularly in cases of pre-existing kidney disease or conditions that may compromise renal function. Special considerations are needed for these patients to minimize the risk of renal complications during anesthesia. Drug-related effects. Some anesthetics, especially certain intravenous induction agents, may have direct effects on renal function or metabolism. This can influence how other medications are processed by the kidneys. Respiratory depression can occur in the respiratory center of the brain, which results in a reduction in respiratory drive and the sensitivity to carbon dioxide concentration of the blood. A reduction in thoracic muscle tone can also result, which reduces how effective ventilation is and can cause hypercapnia, excessive carbon dioxide in the bloodstream. As a result of the respiratory system depression, the patient is at risk of hypoxia, insufficient oxygen supply to the tissues, or hypercapnia. Depression of respiratory drive. Most anesthetic agents depress the central nervous system, including the respiratory centers in the brain. This often leads to a decrease in the patient's respiratory rate and depth, resulting in hyperventilation. Decreased tidal volume. Anesthetics can reduce tidal volume, which is the amount of air moved in and out of the lungs with each breath. This reduction can result in shallow breathing during anesthesia. Altered ventilation to perfusion ratio. Anesthetics can affect the matching of ventilation, airflow, and perfusion, blood flow, in the lungs. This can lead to changes in the ventilation to perfusion ratio, potentially affecting oxygen exchange and carbon dioxide removal. Bronchodilation. Some anesthetics, such as inhalation agents like isoflurane and sevoflurane, can cause bronchodilation, which can be beneficial in patients with underlying respiratory conditions or in those at risk of bronchoconstriction. Increased airway resistance. Some anesthetics can increase airway resistance, making it more challenging for the patient to move air in and out of the lungs. This can lead to an increase in the work of breathing. Hypoxemia. The depressant effects of anesthetics on respiratory drive and the respiratory centers can result in hypoxemia, low blood oxygen levels. This is why patients undergoing anesthesia are typically provided with a higher concentration of oxygen during the procedure. Carbon dioxide retention. Some anesthetics can lead to carbon dioxide, CO2, retention, particularly if the patient's ventilation is inadequate. This can result in hypercapnia, high blood CO2 levels, which may necessitate adjustments to the anesthesia regimen to maintain proper CO2 elimination. Controlled ventilation. In some cases, such as thoracic surgery, patients undergoing anesthesia receive controlled ventilation using mechanical ventilators to ensure that oxygen and anesthetic gases are delivered at precise concentrations while maintaining appropriate respiratory parameters. Recovery of spontaneous ventilation. At the end of anesthesia, the anesthetic agents are discontinued, and the patient is allowed to recover spontaneous ventilation. Close monitoring during this transition is needed to ensure that the patient resumes normal breathing patterns. Want to learn more? Scan these QR codes to learn more about the effects of anesthesia.